Techniques for asking questions. Correct questioning is a key aspect of the medical interview. It has many functions and is used in all stages of the role play. We ask questions in order to
identify the patient's main problem or concern, gather information, to confirm what we have heard, to encourage the patient to express themselves, to check that the patient understands.
Therefore, a good questioning technique can help the role play run smoothly and allow for effective communication between the health professional and the patient. Open questions. Open questions are often used at the start of the interview as they allow the patient to tell their story. Open questions often begin with WH and how question words. Always listen attentively to what the patient says in response to these questions, as this will guide you on what to ask next.
What? What kind of exercise do you do? What does your daughter usually have for breakfast? What time does she go to bed? What time did the accident happen?
Where, when, why? Where does it hurt? When did the pain start? When was the last time you visited a dentist? Why have you come here today?
How long? How long have you had the pain? How long has your daughter had this rash? How long have you been on this medication? How long have you had this cough?
How often? How often do you brush your teeth? How often do the fits occur? How often do you get headaches? How often do you take this medicine?
How many? How much? How many cigarettes do you smoke per day? How many hours sleep do you get each night? How many children do you have? How much do you drink?
Closed questions. Closed questions are useful to get specific details that you may not have got from the open questions. They are also effective in the OET exam as they encourage natural interaction between the health professional and the patient.
Do, does. Do you drink alcohol every day? Do you know what eczema is? Does anyone in your family have high blood pressure? Does the pain wake you up at night?
Is your daughter toilet trained? Is there asthma in the family? Are you eating normally? Are you in any pain at the moment?
Have, has. Have you had any nausea and vomiting? Have you been taking your medication? Has your condition improved since you started taking drug X? Has there been any change in your symptoms?
Can, could. Can you cook for yourself? Can you put pressure on your foot? Could you tell me when you first noticed the rash? Could you open your bowels this morning? Introducing the question topic. One common questioning technique which is very effective is to introduce the subject first with the phrase "what about" or "how about," then follow with a yes-no question, as in the example dialogue.
What brings you here today?
Well, nurse, I haven't been feeling well recently.
I'm sorry to hear that. Please tell me more.
I've been getting tired a lot.
I see. What about your appetite? Are you eating well?
Not really. I haven't felt hungry.
What about your sleeping habits? Are you getting enough sleep?
Well, about 4 or 5 hours a night.
Oh, it's really not enough, is it?
I guess not.
How about your work? Are you under any stress at the moment?
Yes, a little, as it's the end of the financial year, so I am busy. Embedded questions. You can often soften your questioning technique and sound more polite by using embedded questions. Practice this form as it's easy to get the word order wrong. Note, however, that embedded questions follow the word order of statements, not questions.
Why have you come here today?
Could you tell me why you've come here today?
How did you injure your leg?
Could you tell me how you injured your leg?
What time did the accident happen?
Do you remember what time the accident happened?
When did the pain start?
Can you tell me when the pain started?
How long have you had the pain?
Could you tell me how long you've had the pain?
Is it a sharp or dull pain?
Could you tell me if it's a sharp or dull pain?
Does the pain bother you at night?
Can you tell me if the pain bothers you at night?
Why do you want a prescription for sleeping tablets?
Can you explain why you want a prescription for sleeping tablets? Encouraging reluctant patients. Sometimes the patient may need encouragement to provide the information that you need to make a proper assessment of the patient's condition or situation. In these cases, try not to move on to the next stage too quickly. It's better to persist until you get the information that you need. A good technique in this situation is...
Tell me more about that, please, John. Could you tell me more about that, Mary? Please tell me more. Is there anything you'd like to tell me?
Probing questions. Probing questions are sometimes necessary to get more detailed or precise information from the patient.
What do you mean by that? Where exactly is the pain? You look a bit anxious. Is there anything else that is troubling you? Can you explain exactly why you are worried?
Checking understanding. It's very important to periodically check that the patient can follow your explanations and advice.
Is that clear? How does that sound? Do you think you can do that?
Tag questions. Tag questions are used to confirm that your information is correct, and they're a good indicator of confidence and fluency with English. However, they can be tricky to use, as it's easy to make errors.
It's your first visit to the clinic, isn't it? You're here to get your blood test results, aren't you? You haven't been taking your medication regularly, have you? You didn't sleep well last night, did you? Your daughter's only 8 years old, isn't she? It's causing you quite a bit of discomfort, isn't it?